Thank you for listening to Depictions Media Radio.
Hello to everyone. From WHO headquarters here in Geneva, my name is Tarik Yasharevic, and I welcome you to this virtual press conference on the launch of the report on the global tobacco epidemic. This is the 8th report in the series of Empower reports funded by Bloomberg Philanthropies. Those journalists who have asked to get embargoed copy had opportunity to go through the report in the previous days. Today we will discuss the key findings as well as measures that are being taken to fight tobacco epidemic. The report as well as the press release has been already posted, so there is no embargo for this press briefing. With us today, as announced in the media advisory, we have Dr. Rüdiger Krech, who is our Director of the Department of Health Promotion here at WHO. Dr. Vinayak Prasad is the Unit Head, No Tobacco Department of Health Promotion as well. And also with us is Dr. Kelly Henning, who is a Public Health Program Lead with Bloomberg Philanthropies. So we will start with the opening remarks, and then we will open the floor to questions. Those journalists who would like to ask a question, please click raise hand, and we will put you in the queue. So with this, I'll give the floor to Dr. Krech to tell us more about where we are when it comes to tobacco epidemic and what is being currently done to fight it. Dr. Krech.
Thank you, Jarek. Good day to all of you who join us today. We are at a time in history where we would and could be easily distracted by the many novel and emerging products that have been propagated onto the market by the tobacco industry. But we need to stay focused on the goal, now rooted in the Sustainable Development Goals, to reduce tobacco use globally. Over 8 million people die annually from tobacco use and exposure to tobacco smoke. Tobacco is a leading cause of preventable deaths. Saving these lives has to be a priority. Millions of people live in poor health due to tobacco, and many are unable to work and take care of their families. Tobacco use has been on a steady decrease. We should acknowledge this achievement, understand better what has worked to get this far, and accelerate into the future. We never expected this to be easy. It will take time, but mostly determination and commitment to beat the tobacco epidemic, and this is what countries have continued to demonstrate and is evidence from the results of this report. There are other challenges ahead. COVID-19 has brought with it new concerns. We know that smoking worsens the outcomes of COVID-19 infections and that tobacco use is closely associated with the underlying conditions that make so many people more vulnerable to severe COVID-19 outcomes. Health systems have been challenged by the pandemic and services for non-communicable diseases disrupted. Going forward, tobacco's role in people's vulnerability will need to be embedded in our efforts to build back better and stronger. I thank you.
Thank you very much, Dr. Krech. Now, Dr. Prasad, if you would like to tell us more about the findings and key points of the report.
Thank you, Tariq. Good afternoon, good evening, colleagues. Since the last report, that was in 2019, this report looks at progress, and we have seen that more than 24 countries have actually made significant progress in policies at the highest level. Much of the gains have come from pictorial health warnings. Now we have more than 100 countries, 101 countries to be precise. More than 60% of the population now have that. Other policies have also moved forward, but tobacco taxation has been the slowest. There have been some policies which are seeing a reversal, and the one which stands out is cessation services because of the COVID pandemic last year. So this year's focus on World Tobacco Day was to see the scale up of cessation. The other policy which seen some downswing also is that some countries have reduced their tobacco taxes. We still have 49 countries which don't have any of these policies at the highest level. So there's a lot of work to be done, and most of these countries are LMICs and LDCs, low-income countries. This report's focus on electronic nicotine delivery devices, commonly known as e-cigarettes. What do we see? 56 countries monitor this. So the rest of the world doesn't monitor this. So we cannot have a global trend, and we need the countries to start monitoring use of electronic nicotine delivery devices and non-nicotine delivery devices. On the policy front, what do we know? We have 32 countries that have banned use of electronic cigarettes. Now, it's a mixed number. Of the 32, 9 are high-income countries, 18 middle-income countries, and the rest low-income countries. Then 79 countries partially regulate these products. And out of the 79, only 9 of them ban flavors. So we have 70 countries which do regulate, like banning smoking of these products in public places or putting some advertising or graphic warnings similar to tobacco, but 70 of them don't ban flavors, and that's a problem. And then there's the remaining 84 countries which do nothing. So we have a whole free ground for the tobacco industry to target the most vulnerable. Who? The children. So what are they doing? This report identifies some of the challenges. One, because children look at flavors, the countries that have not banned flavors or restricted them, the industry has made good inroads. What second we have found is that those children who are non-smokers, don't take tobacco, but go into e-cigarette use, end up 2 to 3 times, almost 3 times more likely to become tobacco users when they grow up. That's a serious problem. And then sale restrictions. So while 90% of the world has put restrictions on selling cigarettes to minors, only 42%, right? Yeah, 42% of the countries have put any age restrictions, so anybody can go and buy. So that's again a problem. And then what we are seeing is that more than 2/3 or more than 70% of those who are smokers shifting to electronic cigarettes, they end up still using tobacco. So they're dual users. They just switch partially. Again, that's more harmful. And so that's also a challenge which we are seeing. We also see that the quit options like cessation services, which we have, counseling, text message, they all work for e-cigarette users. So it's a good opportunity for all e-cigarette users to use any of these tools to quit. Do you remember, we have 1.3 billion tobacco users even now. So 1 billion of them are smokers, and more than 300 million of them all into smokeless tobacco use. So the report shows progress, but we still have a major problem ahead. Thank you.
Many thanks, Dr. Prasad. Before I give the floor to Dr. Henning, just to remind journalists that if you wish to ask a question, please click icon raise hand. We did receive some questions earlier by email. We may also try to address at some point. Now I would ask Dr. Henning, who is Public Health Program Lead at Bloomberg Philanthropies, to tell us more about the role of Bloomberg and other partners in tobacco control, and maybe also have a few words on a tobacco industry interference and how this can be dealt with. Dr. Henning.
Thank you, Tarek. Thank you very much. First, I would like to extend my congratulations to WHO for producing this report in such a difficult year and on collecting brand new data on ENDS or electronic cigarettes, much of this data for the very first time. We are really proud to partner with WHO on tobacco control and on this report since 2007. When we speak about ENDS products or electronic cigarettes, I want to spend just a moment talking about the tobacco industry and their role, which is so intertwined with these products. For decades now, the industry has promoted new products, often claiming that the new products are less harmful. We saw this with filtered cigarettes, we saw this with low-tar cigarettes, and even menthol cigarettes. And this is now another version of the new product dialogue. We know e-cigarettes are extremely appealing to children, and the industry's goal is to get a whole new generation of users addicted to these products. Tobacco and ENDS companies use sleek product designs. They promote through social media influencers and flavors which attract kids to these products. In the United States, 2011, the percent of high school students using e-cigarettes has increased from 1.5% to 19.6%. And even though we see some encouraging decreases in the last year or so, the prevalence of use among students is still very, very high, and the U.S. has not yet effectively addressed or regulated these products. Kids are attracted to flavors, with 85% of U.S. kids using flavored products like fruit flavor or mint flavored. And we've seen major industry pushback against every effort to regulate flavored products in the U.S., despite evidence that kids are using these. The report documents tactics used by the industry to undermine Empower, the FCTC, and other tobacco control policies countries are working so hard to pass, using tactics like creating front groups and intense lobbying against policies. We have seen these tactics employed across the entire globe. Governments and other stakeholders have ways to counter industry tactics, and these are laid out in this report and are based on the FCTC. Some actions governments can take include requiring researchers to be transparent about their funding and their interaction with the industry, treating state-owned tobacco like private tobacco companies, and making sure conflict of interest policies are in place so that policymakers working on tobacco control do not have clear industry ties. Some countries are already taking action to address these new products. 111 countries in total have some measure in place to address ENDS, but that means that 84 countries have no existing policies to regulate these products. Much more work is needed, and this data helps us guide the way forward. So thank you very much.
Thank you, Dr. Henning, on these opening remarks. Now we will start with questions from journalists who are online, and we will start with Jérémy Lange from Radio France Internationale. Jérémy.
Thank you, Tarek. Hi, everyone. I've got two questions. The first one will be, what are the main marketing strategies that you would like to see banned? Is it the flavor issue that you just raised, for instance? Would you like to see those flavors banned so as to prevent children from using those products, or electronic cigarettes? And the second question is, regarding a comment by the head of Philip Morris just recently, that he said that he would like to see a world without cigarettes as soon as possible. The question is simple: do you believe such claims?
Yeah, thank you very much for these two questions. Now, first of all, let us look into these flavors. There's about 16,000 flavors currently for e-cigarettes, and bubble gum and vanilla ice cream, choco cookies. I think they appeal more to my grandchildren than to me. So if that is not regulated, and I think Dr. Prasad and also Dr. Henning outlined very clearly how many countries have not yet regulated the use of e-cigarettes. That means that kids can go and get e-cigarettes for these flavors. And we know that you are much more likely then to use cigarettes in the end. At least twice, if not three times more, the risk is there that you will then become a cigarette smoker. That calls for exactly the same regulation as cigarettes you have. So that's what we advise countries to do and speed up because as we speak, new devices get on the market, new flavors get on the market. This is an issue that requires strict regulation. On this news of a tobacco company saying that they would like to have to stop cigarettes production, we usually don't comment on this, but let us be clear. If you have been part of the problem, or actually a big part of the problem, of killing 8 million people, we have seen many tactics in the past, like light cigarettes, filter cigarettes, menthol cigarettes, that also claim to be the healthier alternative. While the evidence is not yet totally conclusive on the issue of e-cigarettes, we know that they are also harmful. So therefore, I don't believe this time that all of a sudden you turn from being the real problem to being part of the solution. I don't buy that.
Thank you very much, Dr. Kreer. Dr. Henning, would you like to comment on this one? Would you like to add something?
I agree with the comments by Dr. Kreer. I would also say that, just to be clear, we do believe that flavored e-cigarettes should be banned. Tobacco flavor e-cigarettes exist, but the goals in the U.S. right now are to ban all flavors because, as was outlined, these flavors are extremely appealing to kids, and 85% of e-cigarettes used by kids in the U.S. are flavored. So yes, we agree with that point. Thank you.
Thank you, Dr. Henning. Let's go to Jakarta Post in Indonesia. We have with us Rifki Ramadan. Rifki, please unmute yourself and go ahead.
Hi, everyone. I have 2 questions as well. Firstly, what should countries with several high compliance in several aspects of empower, but low or lack of compliance in several other aspects of empower do? My second question would be, what should a country do where there is no regulations on ENDS? However, the use of such device has become very prevalent in such countries. Thank you.
Thank you, Rifki. Maybe Dr. Prasad will start.
Thank you for your question. So there are 2 aspects to it: moving policies and then getting into implementation and compliance. So there are a number of countries that have moved their policies in the right direction, but then they don't have the resources or the infrastructure in place to improve compliance and implementation. And that's what we are seeing in a number of countries. So to answer your question, those countries which have low compliance but have already got their policies in, it's not a question of political will. The will is already there. The policies have moved, but then we need to get to support the implementation. So it requires community participation, but it also requires governments to invest in setting up national tobacco control programs, multi-sectoral coordination mechanisms, because it's the whole of government approach which is the only way to move forward, because raising taxes will require finance ministry, looking at livelihood will require labor ministry and agriculture ministry. So that's an important part. The countries which are on low compliance and have no resources, no policies, we need to create policy coherence. And Coming from Jakarta, Indonesia is a good example where we need to create policy coherence amongst all stakeholders, not just the health ministry, but other ministries in Jakarta, in Indonesia to move the policies, because Indonesia is still one of the highest burden countries in the world. Thank you.
Many thanks, Dr. Prasad. Let's move to next question. We have Agence France Presse and Robin Miller with us. Robin?
Thank you for taking my question. Simply put, how would you describe people who target an addictive, harmful product to children that kills 8 million people a year? Thank you.
I would say criminal. It's the most criminal act, and it's a human rights violation. So those who are targeting children, irrespective of who they are, especially with toxic and poisonous products, it's a criminal action, and it's important to take note of. The Framework Convention recognizes that on tobacco, we cannot take chances, especially with children, because their brain development gets impacted. They run the risk of being addicted for the rest of their lives.
Thank you, Dr. Prasad. Dr. Henning, would you like to comment on this?
I think Dr. Prasad summed it up very well. I would agree with him completely. I don't have anything to add. Thank you.
Thank you. And indeed, it's time to call these things by their name. We will now call on Stephanie Nebehay from Reuters. Stephanie.
Thank you, Tarek. I recall that this framework convention that was negotiated here many years ago, I recall that neither the US nor Switzerland nor some of the other countries that are home to big tobacco have ever ratified the treaty. Is that hopeless, and how does it affect your efforts to get regulation of tobacco and e-cigarettes in particular in this instance? Thank you.
So both these countries are signatories to the Framework Convention. They were part of the process of negotiation of the treaty. At the moment, we have 181 parties. So we made progress in terms of number of countries that have gone into ratification or accession. The US has moved their policies in the right direction, and it's the internal processes which take time in the US. Likewise, Switzerland still needs to catch up on some of the policies. Their tobacco use is still higher than the rest of the European countries. So yes, we still need to do more in Switzerland, likewise with the US.
Thank you, Dr. Henning. Would you like to add something? Is it Dr. Clark, Dr. Henning, maybe, because it's on the US?
Yes, I would agree. You know, in the United States, a lot of our policies are not just at federal level, but also at state level. And there's been a lot of progress in certain areas like smoke-free public places, for example. We still have a great deal of work to do on these products that we're talking about now, ENDS or e-cigarettes, although some states and localities, state of Massachusetts, for example, have banned flavors in ENDS, and there are a number of others. So there is work moving forward. I would also just say from Bloomberg Philanthropy's perspective, we, as you know, are funders in the area of assisting countries that want to work on tobacco control, and we don't take into consideration whether they are a ratified party to the FCTC, although of course we promote all the FCTC policies, but we are pretty open in terms of any country can come to us to request assistance.
Many thanks, Dr. Henning. We have just received a request to send names and titles of our speakers. As we don't have a nameplate, so we'll put now that in a chat So you had it, but also you had it in the media advisory, but my colleague will put it in the chat. I understand Stephanie has a follow-up question. Stephanie?
Oh, thank you. I was just, wondering whether to the effect that their failure to ratify has had any impact on your efforts to get the U.S. in particular and Switzerland to, regulate more e-cigarettes. I didn't hear from the WHO, from Mr. Prasad, anything on that.
For WHO, they are member states. All 194 countries are member states of WHO, and we work with each one of them, including with the US. The US is committed to moving forward. We recently had a Global Tobacco Regulators Forum, and the US FDA is currently the chair of the forum, looking at all of the evidence and the science in terms of regulating new and emerging products. So they are very much in the know of what's the global progress, what's the global science, what's the global evidence, and as we were briefed by the US government officials, they are working on it. In the regulators forum, that was the feedback we received. Thank you.
Thank you very much. We have Christophe Vogt, Agence France Presse, so another reporter from AFP. Christophe?
Thank you for taking my question. Let's just consider it as a follow-up of Robin's. I read in the report that you have seen a trend of ends use going down, but you're not quite sure yet if it's a real trend or if it's just a start. Could you elaborate on that?
Just to clarify, the report is saying that we do not monitor the global trend, but country data is showing, from 56 country data is showing that the use is going up. It's not saying it's going down, it's actually going up in a number of countries. What we have seen is that in the US, the youth tobacco end use has gone down from the last couple of years, but not globally. The use is actually going up in most countries.
Thank you. Maybe I will read one of the questions that arrived to us, and maybe this is for Dr. Henning. The question comes from Fola de Sao Paulo, and journalist is Ana Estela de Sousa Pinto. The question is about movies. It says, among 24 movies competing for this year's Palme d'Or Cannes Festival, 20 had main characters smoking, usually in compelling scenes. Is that a concern? If it is there anything that could be done to counterbalance that? Dr. Henning, maybe?
Yeah, I can start. Thank you for that question. It's a great question. It is a concern. Smoking in movies normalizes the idea of smoking, makes it socially acceptable, and is often done under the guise of being important for the scenes and for the time, but in fact could often be addressed. And there has been some movement among researchers in California to try to address this in the U.S. somewhat, with very, I would say, fairly minimal movement. But India is a big leader in this area, and I'd like to turn it to Dr. Prasad, who I think knows a little bit more of the detail about the India situation. Dr. Prasad?
Thank you, Dr. Henning, and it's correct. So India has made progress in the last couple of years in restricting the use of placement of tobacco products in movies, TVs, and theater. So there has to be an editorial justification for any smoking scene to be shown, and the justification comes with a lot of restrictions. For example, disclaimers by the actors at the beginning of the movie, some no tobacco related messages at the beginning and the middle of the movies, including streaming when the scene is happening. So these are important, but then even there, the industry is trying to circumvent by using global streaming channels and trying to bypass it. So the government of India is still looking at it. Similar efforts are being made by the Middle East, where the tobacco industry is using every opportunity to use theater to push their products. And they're also looking at similar options. So there are options exist, it works, so the more countries, including Brazil, should be able to adopt it. Thank you.
Thank you very much, Dr. Prasad. Interesting question from healthcare freelance journalist Yaqeen Ahmed Qureshi from Pakistan. Why do we call tobacco epidemic an epidemic, like we use the word for communicable diseases?
Okay, let me take the question and maybe Rudy and Dr. Henning can also attempt. So tobacco is highly addictive, and we know that it's as addictive as cocaine. So it's both an epidemic and it's a legal drug. It's legally sold and it needs to be regulated. So the policies which help regulate are all cast within the Framework Convention as demand reduction measures and supply reduction measures. But it's still an epidemic because there is a virus to it. The tobacco industry is the vector and it's spreading and it still encompasses large populations. That's what the epidemics are. So it's quite akin to an epidemic, but it's still a legal drug. I hope I have been able to answer some part of it.
Thank you very much. I understand that we don't have further questions from journalists who are online, so I would maybe ask our speakers to have some final thoughts before we conclude the briefing. Dr. Kher, maybe.
Yeah, thank you, Tarek. What we've seen in this report, there's good news and there's bad news. The good news is that the progress on tobacco control went ahead despite all the challenges we faced during the COVID-19 pandemic. And that is due to a lot of compassion of people working in tobacco control, in ministries around the world, and hundreds of people who contributed to this report. So we as WHO are extremely grateful to those people who are working on tobacco control. At the same time, we see that new challenges arise, and these challenges include the non-regulation of e-cigarettes, and that is something that we need to ring the bell for. As we said before, the tobacco industry shifts their tactics towards e-cigarettes. If you look at their budgets in how they actually do PR for e-cigarettes, that's skyrocketing, and they do this on purpose. And so let us not be naive in thinking that the tobacco industry would be part of the solution right now. They are still a big part of the problem. And this is why then, as member states, we advise our member states to regulate e-cigarettes much more. You can modify most of the devices. That means that you can increase the intake of nicotine and other substances yourself, or there's also patents that are held by the tobacco industry that they can manipulate devices from outside. So let us be clear that there needs to be a lot of work in this area, and this report just shows the trends in this regard. Thank you very much.
Thank you, Dr. Gray. Dr. Prasad?
Thank you, Tariq. What I would say is that the Empower measures are all evidence-based measures and they work. It is quite evident from the report. Taxes are the least implemented, but they are the most impactful, and they can actually play a role in the Build Back Better narrative with tobacco, with COVID. There's enough funds can be generated just by raising tobacco taxes. And then we need to focus on the tobacco users and help them quit. And that's very important during these times. We are seeing good progress. For example, most recently we got Timor-Leste at 93% of the warning labels, which is the highest in the world. So in the middle of a pandemic, they're moving forward the policies. We need to ensure that the e-cigarette regulation, which more than 150 countries need to do more. We need to work further on that. And I think it's important to keep giving the message that what WHO is doing is looking at all of the evidence. We are not in the 60s and the 70s. That's what the tobacco industry is trying to make out. We are looking at every single piece of evidence which is coming out in terms of use of electronic nicotine delivery devices. And what we have, this report points out is that the industry is misleading the public and the government, trying to mislead the government, and we need to be conscious of that. Thank you.
And finally, Dr. Henning, would you like to have some final thoughts?
Thank you, Tarek. Just very quickly, I want to add a footnote to my earlier comments because it seemed there might be some confusion about the decline in e-cigarette use in the United States among kids. I just want to say that there is currently in 2020, 1 in 5 high school kids are using currently e-cigarettes. That's 3.6 million kids. So I don't want to leave the impression that this is a situation that's controlled or is completed in the U.S. There's still a very large problem here. In terms of summary, I would certainly agree with all the other comments. I would also say that governments just need to look at these Empower policies and evaluate where they stand internally. We have 2 countries right now, Turkey and Brazil, who have passed highest level Empower across the board. We need many more countries. Let's challenge ourselves to have 50 countries in the next couple of years reach the highest level across all those Empower policies. That's what we really need to control this epidemic and to protect our kids. Thank you very much.
Thank you, Dr. Henning, and thanks to all journalists who were with us today. The report and the press release are posted on WHO website. With this, I wish you a wonderful rest of the day.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.